Risk factors for low blood sugar when you have diabetes. Hypoglycemia, also known as low blood sugar, can be uncomfortable. Along with dizziness, fast heartbeat, blurred vision, shaking, weakness, and headaches, you may feel confused and have trouble concentrating. This is why it is important to assess your risk of hypoglycemia during diabetes treatment. Once you identify your risk factors, you can work with your doctor to develop a strategy to prevent attacks from occurring. Plus, you can plan to treat an episode before it becomes serious. Here are 15 things that can increase your risk of low blood sugar. 1. Age increase. The risk of severe hypoglycemia nearly doubles with each decade of life after age 60. This may be because older people are more sensitive to the drug. 2. Skipping meals. If you have diabetes, skipping meals can throw off your blood sugar balance and can cause your blood sugar to drop too low. Taking certain diabetes medications without food can significantly increase your chances of developing low blood sugar. 3. Erratic eating patterns. Eating irregularly during the day can upset the balance between blood sugar and diabetes medications. Research shows that people with regular eating habits have a lower risk of hypoglycemia than those with irregular eating habits. 4. Heavy exercise. When you exercise, you use up your blood glucose faster. An increase in physical activity can also increase your sensitivity to insulin. Exercising heavily without monitoring your blood sugar can be dangerous. To avoid hypoglycemia during exercise, check your blood sugar before, during, and after exercise. You may need to eat a snack before starting an exercise program. Or, you'll need to snack or take a glucose tablet if your levels are too low after exercise. 5. Weight loss. Because obesity increases the risk of diabetes, weight control is an important part of diabetes treatment. But losing weight too quickly can be risky if you're taking diabetes medication. During active weight loss, it's important to see your doctor. You will need to discuss adjusting the dosage of some diabetes medications to prevent episodes of hypoglycemia. 6. Taking beta blockers. Beta blockers are medications used to treat high blood pressure and other conditions. Although beta blockers don't necessarily increase your risk of hypoglycemia, they can make it harder to recognize the symptoms of an episode. For example, one of the first signs of hypoglycemia is a rapid heart rate. But beta blockers slow your heart rate, so you won't be able to rely on this sign. If you take beta blockers, you will have to check your blood sugar more often and eat well. 7. Using the same injection site too often. Insulin that you inject repeatedly into the same spot can cause fat and scar tissue to build up beneath the surface of your skin. This is called lipodystrophy. Lipodystrophy can affect how your body absorbs insulin. Continuing to use the same injection site can put you at higher risk of hypoglycemia as well as hyperglycemia. This is why alternating your injection sites is so important. Remember that different parts of the body absorb insulin differently. 8. Antidepressants. The use of antidepressants is strongly associated with hypoglycemia. The study authors note that symptoms of depression, such as loss of appetite, may also contribute to an increased risk of hypoglycemia. 9. Drinking alcohol. Drinking alcohol can cause your sugar levels to drop overnight. If you drink alcohol, be sure to eat a meal or snack before bed. Also, be extra careful when monitoring your blood sugar the next day. 10. Cognitive dysfunction. People with diabetes who also live with cognitive dysfunction, dementia, or conditions like Alzheimer's may be more at risk for hypoglycemia. 11. Basic damage of kidney. Your kidneys play an important role in metabolizing insulin, reabsorbing glucose, and removing drugs from your body. For this reason, people with diabetes and kidney damage may be at a higher risk of hypoglycemia. 12. Underactive thyroid. The thyroid is a gland that secretes hormones to help your body regulate and use energy. People with diabetes are more at risk of developing hypothyroidism. With too little thyroid hormone, your metabolism can slow down. As a result, your diabetes medication stays in your body, which can lead to low blood sugar. 13. Stomach cough. Gastric upset is a disorder in which the stomach empties too slowly. The condition is thought to be related to disrupted nerve signaling in the stomach. While many factors can cause this condition, including viruses or acid reflux, it can also be caused by diabetes. In fact, Women with diabetes have a higher risk of developing gastroparesis. With gastroparesis, your body won't absorb glucose at its normal rate. If you take insulin with meals, your blood sugar may not respond the way you expect. 14. Long-term diabetes. The risk of hypoglycemia is also increased in people with a longer history of diabetes. This may be due to taking insulin therapy for a longer time. 15. Pregnancy. Pregnancy leads to major changes in hormones. Women with diabetes may experience a drop in blood sugar during the first 20 weeks of pregnancy. Taking a normal dose of insulin can be too much. If you are pregnant, talk to your doctor about reducing your insulin dose to avoid hypoglycemia. If you like this video, please support it and subscribe and share it with your friends on Facebook, Twitter and Google+. Thank you for watching and see you next time.